One of the most important tests you can get is something called an OmegaCheck. This is a blood test that looks at your relative levels of omega-3 fatty acids and omega-6 fatty acids. Now, we need both of these types of fatty acids for several physiological processes. However, generally speaking, if you have an overabundance of omega-6 fatty acids in relation to omega-3 fatty acids, then it's said that your body may be in a pro-inflammatory state. So it's easier for inflammation to be created in your body. And of course, that's not a good thing. On the contrary, if you have less omega-6 in relation to more omega-3s, then you'll be in a less of an inflammatory state or an anti-inflammatory state. Now, it's easy to get an excess amount of omega-6 to omega-3s from a normal healthy diet. If you're somebody who eats animal protein, some nuts, some seeds, some fruits and veggies, etc., you may very well have a high ratio of omega-6 to omega-3s. The answer for this is to buffer your diet with more cold water fish, more walnuts. There's some other foods like that you can eat. Now, this can be difficult to do, and everybody's got a different physiology. So for me personally, I have long supplemented with omega-3 fatty acid supplements. So these are fish oil supplements. This is one way to tip that scale back. Also, you can get too much omega-6 from eating a bunch of junk food as well. So remember, omega-6s are things like arachidonic acid, things like some of the seed oils that people are running around saying they're toxic. They're not toxic, it's just the relative ratio. You've got too much pro-inflammatory omega-6 in relation to those omega-3s. So it's important to discern where those omega-6s are coming from. Sometimes, despite having a good diet, you may have that high ratio of omega-6 to omega-3. So the answer for this is to increase the omega-3s in your diet, either through your diet or through supplementation. And by doing so, you're going to decrease your overall risk, so to speak, of creating inflammation. Now, this is one of the core supplements that I take day in and day out as a master's athlete because we're always trying to keep inflammation at bay. So this is something that I found helpful for myself, and I thought you could use that information too.